You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, staying connected with your partner with the relationship expert of the Coachella Valley. We'll be right back.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. With us today, we have Dr. Barbara Kreedman, the relationship expert. She's the author of 2 books, Staying Connected to Your Partner and Why Love Stops and How Love Stays. Dr. Kreedman, welcome to the show.
Thank you.
Now, we've had you on the show before, and I told you the last time, I said, I wish I would have read your book before I interviewed you, because I was very skeptical. I'm no longer skeptical, and I'm high on getting coaching or therapy.
Good.
A lot of people skeptical, by the way.
Until they understand why they need therapy, people can wait into their 40s and 50s to enter my office for the very first time.
Are you seeing results, though? I mean, over time, and you've helped hundreds of people?
I've helped thousands of people, and I see results all the time because I don't just listen, I give back information. I tell them I want to know why a person does what they do, where the breakdown occurs, and how to seek resolution. And that's what we do in my office.
Okay. And I'm sure everybody goes through this. It says here, why love stops and how love stays. Okay? Now, since romance over time seems to dwindle away, can people really do anything about it? I mean, are you giving techniques? Are you giving advice, perspective? What is it?
The ultimate question is, do people really change? And they do. You can't always resolve core issues, but the next best thing is to understand why you do what you do. So when you ask that question, by understanding why you do what you do, where it comes from, what you're acting out from your past, you can let go of some of those primitive hurts or unresolved issues and move forward. And then you're not blurred by bringing your past into your present. You can now experience the present from your adult.
Okay, from reading your first book. I don't plug books on this show, but I'm going to plug your book. Great book.
Thank you.
That you call it transference. That means people's, I guess their childhood, and I'm paraphrasing here, affects how they act later in life, especially in relationships. Is that right?
We are a conditioned species. Whether you say behavioral therapy, analytic therapy, we bring our past into our present. It doesn't just go away. Even if we're not consciously aware of what we carry, we do carry hurts and unresolved issues from our past. That's called transference. So when we're carrying a wound from our past, not knowing it, we're going to re-experience people in the present based on our conditioning. And that's simply called transference, and that's considered a negative transference.
So a spouse can say something that can trigger something that was an irritant growing up. Is that what you're saying?
A spouse can be very innocent, say something, get a very strong negative reaction, and the spouse doesn't know, why did you react the way I did? I didn't mean anything from it. But in fact, the person experienced something from their past, either consciously or unconsciously, that they're reacting to. So they're reacting to their past, and they're not seeing the present.
Okay. Are you helping people understand themselves and, of course, each other better? Is that right?
Absolutely. When a couple comes into my office, not only am I dealing with the here and now because I want to know the present problem, but I also want to know how they see the present problem. And how a person sees their problem tells me about their past and tells me whether they're today oriented or their perspective is off a little bit, basically from their conditioning.
Do you think men and women are different? Like the book, you know, that men are from one place, women are from another place. Are they really different?
Well,
do you believe that?
There are differences, but there are women that think like men and there are men that think like women, so those boundaries are always blurred.
So not necessarily true then, in your view, that men are one way and women are another way?
Not necessarily, because again, our conditioning determines to a large part who we are today. I mean, you do have those physiological genetics that we bring in from our Constitution, but in addition to our Constitution, we're simply a conditioned species based upon our upbringings. Now, boys are raised not to cry, not to feel, to be more stoic. So in that sense, they're conditioned to be different. And women are conditioned to feel more and to be more into their needs. And so in that sense, again, it's a conditioned reaction to our upbringing.
Before we get into today's topic, staying connected with your partner, who's your typical client that goes to see you? What are the different problems they have?
My typical client is a 40, 50-year-old who's never been in therapy before, who unfortunately has carried patterns with them through the years, really never wanted to be in a therapist's office, and found that whatever they were stuffing caught up with them. And what I mean by that is people can have symptom-free issues for 20, 30 years, and all of a sudden they're experiencing depression for the first time, they're experiencing anxiety for the first time, they're sad for the first time. Something has finally surfaced that they've ignored through the years, and then they call me.
I mean, after 20 years of marriage, something can surface.
After 20 years of marriage, something can surface from when they were dating 25 years ago.
Like what? Give me an example.
Years ago, I had a person enter my office, and he was holding on to his girlfriend at the time, 30 years ago, going on a trip to Europe, and she didn't contact him while she was gone. They've been married 30 years, and he held on to that injury that he wasn't important and that she forgot about him during that 3-month stint in Europe.
And that came out during therapy?
And that came out during therapy.
So how does that help their relationship 20 years later, 30 years later?
Well, in fact, unfortunately, what it did to the relationship is when people get together initially, they are the most vulnerable. Their defenses are down, and they're receptive, typically, to their partner. Then injuries occur, and if they're not addressed, those injuries add on to one another through the years, and then their reaction to their partner changes based on injuries that were never addressed or discussed or understood, resolved, and put away. Instead, they swallow those injuries and react to their partner basically based on transference or misinformation, and they react to their partner through the years based on things that were never addressed.
Do you see transformations right away? I mean, have you seen it? Because I think one of the, and I'm sorry to interrupt here, but it seems like one of the problems with therapy, at least from my perspective, looking on the outside, that you have to go forever. Is that just not the case?
It's not the case. Those people that stay in therapy forever are there because they are comfortable with their behavior, even though they say they're not. It's called a secondary gain to pathology. It's familiar, and you don't want to change what's familiar because you know what happens in those boundaries. But when you go to other areas that you've not explored and that you're afraid of, it's sort of like you don't know how to handle it and you don't know how to respond to it. But in fact, you're going to be stronger and more powerful when the child is understood and replaced with the adult. It's the child that keeps us stuck, not the adult. Adults come into my office, but it's the child part of them that keeps them stuck.
So what are the different categories of relationship problems?
Well, people either feel that their relationship is over and they want to give it one more shot, maybe, or they come into my office and they say they want a divorce, so why are they in my office? Perhaps out of guilt.
Is that common?
It's common.
One drags the other one in?
Yes. But what I say to them, it's very easy to get a divorce.
Okay.
But it's a lot easier. You've been married all these years, you have kids, you've established a family. You don't want to just pick up and leave and start all over. You're 40, you're 50, I mean, you don't want to just do that. If you have to do that, that's fine, but at least give it a shot, find out where the breakdown occurs, and see if you can seek a better understanding between one another. At least you're walking away knowing you've done all that you can do. What happens with a lot of people, I see them down the road, they didn't come to therapy first. They got a divorce. They never really looked at why they left. and they carry a lot of guilt with them into their next relationships, and it affects their next relationship because they left a family, they left children, and they didn't understand why they left. They just needed to go.
So by going to a therapist, a relationship expert, you're saying it relieves some of the guilt, or it can help them with the transition process, or maybe keep it together.
Absolutely.
Is that right? I mean, are you always trying to keep it together? Or what are you trying to do?
Initially, I am trying to keep it together. I mean, that's what people really want, is to resolve their relationships. But when you get to the point that one or both parties are unable to seek any type of understanding or resolution, there are times that it's over and people need to move on. But again, the biggest gift they can give themselves and their partner is to understand why it's over. Even that in and of itself is a real blessing.
We're going to take a quick break. When we come back, I want to talk and give specific how-tos for the audience on how they could stay connected to their partner. Think we could do that?
Absolutely.
Okay, great. You're watching The Wellness Hour. I'm Randy Alvarez. We're here with Dr. Kreedman, relationship expert. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Barbara Kreedman, relationship expert. We're talking about her newest book. Dr. Kreedman, staying connected to your partner. Do you really think that you could accomplish, staying connected to your partner by reading a book?
Absolutely, because you're understanding why you're not staying connected. Staying connected talks about commitment issues, why we attach too much to our partner, or why we have difficulty attaching even if we're married.
What does that mean, attaching too much?
Codependency. Codependency is understood in my book from a different perspective. And in terms of people that can't commit, the guy that never gets married, he's 40 years old, 50 years old, he keeps dating, he can't commit. Sure. Or the guy that is married and yet has relationships outside of his marriage. What I focus on, again going back to childhood, is conditioning. If a child is made to feel free as they begin to individuate, and we begin to individuate at 4 months of age. If a child is given permission, good boy, for moving away from the parent, the child then knows that it's safe to explore.
Okay.
And in adult life, they won't feel smothered or controlled. But if a child from childhood is made to feel confined, that they have to operate within a box, that they're not okay.
Like an authoritarian parent.
Like an authoritarian parent who is going to punish them for individuating, then you're going to see conflicts in one's adult life. For the people, so the child and the adult has a dilemma. Do I stay connected to myself and lose my connection with the parent or love object? Or do I lose myself and stay connected to the parent? So the child and the adult needs to know that they can have both self and their love object. From early conditioning, if a child feels threatened that they're going to lose the love of their love object, and that's the ultimate fear. Our ultimate fear in childhood is, are we not going to be loved? Are we going to be emotionally abandoned?
Okay.
From that, the child chooses, do I give up self to maintain the love of the love object, or do I give away the love object to maintain the self? I refer to that as the push-pull personality. I want you, then I feel smothered, then I push you away. That's the push-pull adult. And it's because, and you see that in a lot of marriages, they stay connected to you and then they go away, and you never know why you have these cycles in your relationship. But you have these cycles.
So in and out of closeness with your partner.
In and out of closeness because unconsciously you're feeling smothered. And why are you feeling smothered? Either you're afraid to verbalize, or you are afraid to say no, or you're afraid to get your needs met, and that's either coming solely from you and your conditioning, or your partner is feeding your child by giving you messages that it's not okay for you to be you.
Okay, so if somebody is watching this, they should ask their spouse, did you have mean parents? I guess by then they would know if they had tough parents.
Well, I don't.
I mean, what do you ask? I mean, how do you know?
To say mean parents, I mean, there are those people
tough,
that come from
authoritarian,
tough,
controlling.
Right. And you can see the people that are in their adult life more distant, more private, need a lot of alone time, those people were controlled as children, and they learned that the only way they can feel safe with themselves is to separate themselves from people. They do it unconsciously. And almost every adult that you see in their adult life comes from that strong, strict, operating within the 4 dots.
Okay, so let's say this is the husband. By going to you, identifying that, what happens? They kind of have a shift in the way they look at things? The relationship?
They're understanding more about their child and why they do what they do, so that if their wife asks them to come home at 6 o'clock, they won't have such a strong reaction, because they're having a reaction because they always had to be there at a certain time as a child, and they carry that conditioning, and then they experience and hear in their adult life from their child's perspective. So as an adult, they don't feel their strengths, they don't feel powerful, they don't feel that they have a say.
Is this too simplistic to say that the people that go to see you, the thousands that have gone to see you for relationship advice and help, that most of them have some type of transference that that's interfering with the marriage today?
Right. They're bringing from their past.
Is it all of them? 100%? 99%?
I'd say a good 90%. Now, we can also have transferences from previous marriages. In other words, we could have a great childhood, but we had a very negative first marriage or second marriage, and we're bringing that into our new situation. So it doesn't always have to be from childhood. It can be from life circumstances.
Now, you've often, and we've talked off camera, and you had ideas for shows. You said, let's bring some real life people on the program that have relationship problems, and we'll fix them right there, or we'll resolve some issues.
Right.
Can it happen that quickly?
It can. It really can. As long as people are motivated to change and they're willing to look at their dynamics, and I do it day in and day out. I have a couple, they come into my office, and I get them to understand 2 things. I get them to understand how they operate, and I get them to understand how their partner operates, and then I get them to understand how their partner hears them.
Okay.
How they hear each other. And by understanding not what is being said, and I refer to that as content, but what they hear, and that's process. It's what we hear that gets us into trouble.
Does one partner always think it's the other one's fault most of the time?
Most of the time, yeah.
Well, is it?
Well, no.
When they go to see you? I mean, do you see?
50-50. I mean,
is it really 50-50? I mean, when they go to see you, you think it's kind of a combination? It's not one over the other?
Well, if someone has a very strong negative past, clearly they're going to have more difficulty hearing without being blurred from their past experiences. But for the most part, it is 50-50, because it's how the other person hears them and reacts to them that becomes their contribution to the breakdown.
Now, what about people that are watching this, that the wife wants the husband, or vice versa, to go? They're saying, I'd love it, we got to go see Dr. Barbara Kreedman. But they're saying, but secretly they're thinking, I don't need Dr. Barbara Kreedman telling me that it's all my fault.
Actually,
what do you say to them? They're afraid. They don't want to hear you telling them, because they know maybe they have problems.
Well, that's true, but actually what happens more often is that the wife verbalizes that her husband won't come to therapy, and I said, just have him come in once. And I relate very well to men, and they understand that I hear them and that I'm not biased in any way, and that I hear their perspective, and they feel very safe in my office, so that I'm not just protecting the female, I'm protecting both parties. And not only am I protecting both parties, but I'm also considering the family unit and how the family unit plays a part in what's going on in their marriage.
When I read Why Love Stops, How Love Stays, I was inspired. It made me want to be better. Is same thing with this book?
The type of therapy that I do, I get results. I'm not here, I've been practicing 27 years, I'm here to get results. I'm here to change and to produce positive changes. Each book focuses on how we do and why we do what we do and how to resolve that.
You like what you're doing?
I love what I do.
What makes you good? You think you have a special discernment or ear for people's problems? I mean,
I do.
Really?
I think one of my gifts is that I'm able to get into your world, both your world as an adult and your world as a child. And by doing that, I'm understanding where you're stuck, what your pain is, and I know how to carry you from your child to your adult to seek resolution.
Okay, we're going to take another quick break. And when we come back, again, I want tips for people watching this. People are asking, give us some how-tos on how to stay connected to your partner, the title of your book.
Okay.
You're watching The Wellness Hour. I'm Randy Alvarez. We're here with Dr. Kreedman. We're talking about relationships. We'll be right back. You're watching the latest edition of The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here with relationship expert, Dr. Kreedman. Dr. Kreedman, a word on adolescence. You work with adolescents, is that correct?
Right.
How so?
Well, oftentimes adolescents are having problems in school, they're having problems with siblings. There's only so many ways adolescents can act out their internal conflicts, and they act it out by drugs, by hurting themselves, by siblings, or yelling at their parents, and so they come in and the parents want results, obviously. My focus is to understand, again, the inner workings of the adolescent, why they're doing what they're doing, and what internally is hurting them.
Are the teenagers, for example, or adolescents, are they the most resistant to see a therapist?
Actually, they may be resistant before coming into my office, but once they're in my office, I think they feel very, very safe because I want to hear their pain.
You are the master of rapport.
I am the master of rapport.
Is that right?
Because people know that I'm not judging them. I'm really there to help them. They feel that I'm 100% involved and that I care about them. And I want to get them to the other spot. I want to get them to feeling happier about themselves and in their life. For adolescents, they're not feeling judged, but it's not as if I'm not tough. I am tough in my office to both adolescents and adults. I do push. I'm not just satisfied with just immediate results. I want long-term results. But for adolescents, since we're talking about adolescents, I'm getting to understand, again, their world. And what's wonderful by dealing with a younger population is I can produce change for life. Whatever we're doing in my office and they're 16, 15 years old, they can hold on to it for the rest of their life, and it's very gratifying for me.
We're just about out of time, but so I'm clear, and people watching this are clear. Your approach to healing relationships, helping people deal with their own problems is what?
I look at why we do what we do to ourselves and to those we love. People that come into my office know that I'm deeper. I look at the primitive reasons, what we're carrying from our childhood that's unresolved, that's perhaps unconscious, that we're acting out in our adult life.
What do you want people to know about you as a therapist?
People know that in the first session, they walk away knowing why they do what they do. What takes time in therapy is changing behavior, but you will know immediately why you're stuck, where it comes from, and how to resolve it.
How to resolve it?
How to resolve
They'll
it.
get better.
Yes.
Does it happen people walk out of there and they feel great? I've heard that about you, by the way.
Thank you.
But does it happen? Could it happen in one time?
Absolutely. Because they will understand immediately why they're doing what they're doing. And that in and of itself is very comforting, to understand why I've done this behavior all these years, and if I just would have known, I could have changed it many years ago.
Okay. Final message here. Staying connected to your partner. We're going to have you back to help us understand. Because people watching this, people in relationships, everyone has that in common. They want to stay connected, unless they've thrown in the towel. They want to stay connected to their partner. You're saying it's possible, and you've seen it?
It's possible, I see it, and I do it. And again, my other book, Why Love Stops, How Love Stays, focuses on our childhood, and it's a workbook that helps you understand what you're carrying from your past to your present. And staying connected to your partner talks about attachment issues, and again from your past, what your conditioning was that either reinforces attachment or discourages attachment.
Okay, what about the devil's advocate that's watching this that says, you know, passion just goes away. The love for a partner after 15 years it's just going to go away. There's no way to keep it together.
Passion changes. It doesn't necessarily go away. It takes different levels. It forms into deeper relationships. What makes a relationship solid is two things: One, you know yourself, and two, you feel safe within your relationship. But you got to know yourself, and that's what I do. I get people to know themselves.
Dr. Kreedman, I want to thank you for coming on the show. Always interesting and always a pleasure.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like information about future airings of this program or other show topics, visit our website at wellnesshour.com. Also, if you'd like a copy of Dr. Kreedman, one of Dr. Kreedman's books, you could call our office or visit our website. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.